Welcome to Loving Pets channel. Today we talk about ferret illnesses and health problems. One of the unfortunate side effects of domesticating animals is that we tend to ignore the presence of genetic diseases that often get passed down with desirable qualities like cuteness or a docile personality. This has especially been the case with ferrets. Let's take a look at some of the most common diseases and disorders in ferrets. Adrenal disease. This is probably the most common disorder among ferrets. It is caused by abnormal growths which affect the adrenal glands, making them swell and produce too much of the female hormone estrogen. The most frequent symptom is hair loss starting at the base of the tail and working up toward the neck. Females may exhibit a swollen vulva, while males may experience difficulty urinating due to an enlarged prostate. The symptoms of the disease can be controlled with medication, though typically surgery is needed, especially if the growths are found to be cancerous. Without treatment, the disease is terminal. Noon really knows for sure what causes adrenal disease. It's less common in Europe than in the United States, and it seems to be at least partly caused by the common practice of American breeders to spay and neuter ferrets while they are still babies. Another possible contributing factor could be an overexposure to bright lights. Ferrets are creatures that would normally spend much of their time underground, in the dark, so too much light has a deleterious effect on their little bodies. Insulinoma. Insulinoma is a cancerous growth of the pancreas which produces excessive amounts of insulin. The ferret then suffers from hypoglycemia as a result. Some of the common symptoms of insulinoma are weakness in the hind legs, lack of energy, glassy eyes, and a dazed appearance. If blood sugar drops too low, seizures will result, and then coma and death. Surgery is often required, but sometimes the illness can be treated with medications, or a combination of surgery and medication. The medications will not cure the disease but treat the symptoms. Lymphoma or lymphosarcoma, both are types of cancerous growths which can affect various organs and are usually fatal. There are usually few early warning symptoms of this kind of cancer. Later on, the ferret may develop weight loss, vomiting, diarrhea, or show signs of difficult breathing. Chemotherapy or surgery can sometimes stop the advance of the disease, but more often than not, the cancer is discovered too late. Aleutian virus disease. This is not a genetic condition, though there may well be a genetic component to the disease, or rather in certain ferrets being resistant to it. Studies have shown that about 10% of shelter ferrets carry the virus without ever showing signs of illness. What happens in ferrets that get ill is their bodies react to the virus by releasing massive amounts of antibodies. It's these antibodies which cause problems, not the virus itself. There is no cure for Aleutian virus, and the disease is often fatal, though it is a slow-wasting disease, and some of the symptoms can be treated so as to allow ferrets a decent quality of life for at least a year or two. Persistent weight loss and lethargy are the two most common symptoms. As the disease progresses, the liver or kidney can fail. There can also be neurological problems. Regular veterinary checkups and a keen observation of any changes in behavior or health are crucial for early detection and treatment of these conditions, ensuring a healthier and happier life for these playful companions. Thank you for watching. If you found this helpful, give it a like, drop a comment, and subscribe. It helps more than caffeine on a Monday morning. If you have any questions, feel free to leave them in the comments. We read everyone, and we are always happy to help. See you again.